Hello, today I'm going to be telling you everything about the respiratory system. So, the two main things about the respiratory system are the lungs. They are what makes you breathe in and out. They let you inhale and exhale. When you inhale, they get bigger, and then when you exhale, they shrink, they deflate. So, without the diaphragm, the lungs actually would not be able to move. That's what really moves the lungs. The lungs are surrounded by the bones called the rib cage. Sounds familiar, doesn't it? Um, so, and when you breathe in, there's actually an air cleaning system. The lungs actually can deliver oxygen and remove it if they're dirty. Fortunately, the respiratory system has something built in that cleans the air for you. There are small hairs inside your nose that filter the dust, the dirt, and the other things that out of the air when you breathe. They're goblet cells present in your nose and airways. They release a sticky mucus that helps also trap these particles and keeps the air a bit moister. And then there are also tiny structures that are sort of like hair called cilia that cover the inside of your airways. They actually clean the dirty mucus up by the throat so you can cough it out. The cilia is actually part of a cell called epithelial cells. So that's about the air cleaning system. How can we keep our respiratory system healthy? Well, the number one way to keep it healthy is to say no to smoking. Every single pack of cigarettes sold in the United States has a message on the bottom of it that says, Surgeon General's warning, quitting smoking now greatly reduces serious risks to your health. So, that is the number one way to keep it healthy. Never smoke a cigarette. Smoking makes it harder to breathe. It damages the cilia, so it can't really clean up the mucus that traps the dirt, bacteria, and other particles. As the mucus makes itself up, builds up, it also covers the airway, making it less easy to breathe. So, you can also if you exercise regularly, that also helps a lot. Your body actually gets better at swapping oxygen and carbon dioxide. So get on a bike, get on your skateboard, jog, go swimming, do anything, any sport, as long as you're exercising. So one way the oxygen is used also is that it goes into your blood. So, the blood actually needs your oxygen. There is a way to remove a waste from your blood. There's a product called carbon dioxide, which is made by your cells, which also goes through the thin walls of the capillaries. However, carbon dioxide goes in a different direction from your cells to your blood. When you take in oxygen, it goes from the air that you get into your blood and the cells that also require it. When you get rid of carbon dioxide, it moves out of your cells and into your blood, and then into the air that you breathe out. How does the respiratory system work when you exercise? Why would you breathe harder when you exercise? You probably know when you're exercising that you get out of breath, hence the name. Your body is really, really working hard to get enough oxygen for your muscle cells and get rid of all the extra carbon dioxide that they are producing. I mean, you don't really need the extra carbon dioxide. By getting to breathe faster and much deeper, your body is able to bring in way more oxygen so your muscles can continue working. But there is also one main thing that makes you talk, and it is called a voice box or a larynx, which is located at the top of the trachea, which you couldn't speak. inside your voice box, there are two elastic-like bands called vocal cords. When air goes through and over the larynx, the vocal cords start vibrating. That is what actually makes you make a sound when you're talking. You can also feel those vibrations when you're talking if you would put your hand on your throat, any spot. The respiratory system cannot always be healthy. There are a couple diseases and conditions that are in the respiratory system. Some kids in the United States and Canada have a disease called asthma, which is a good chance that you or someone you know has asthma. A lot of people have asthma. When you have asthma, the lining of your bronchi gets swollen and the muscles around them start tightening, making it way harder to breathe. Smoke from cigarettes, pollen from certain plants, pollution, animal fur, dust, and even stress can get an asthma attack. A person that has asthma may cough or make a wheezing noise. This sound is caused by air trying to pass through the narrow airways. This actually can make people feel like they can't even breathe at all. Cystic fibrosis. That is also a disease that is inherited from people like your parents. People with cystic fibrosis have a lot of unfrequent coughs, shortness of breath, and may wheeze when they're breathing. Their lungs and airways make a mucus that is much, much thicker than usual. The mucus is much too thick for the cilia to sweep out. Eventually, this thick mucus that you get blocks the airways. This really makes it difficult to breathe. It also makes it much easier to catch infections like colds that can do a lot of damage to the lungs. Cystic fibrosis patients must take a lot of medications and have their chests pounded on a lot to break up the thick mucus that can lead to further infections. There is also a disease called bronchitis. Bronchitis, people with bronchitis also often have. People with bronchitis usually have a lot of bad coughs and difficulty breathing and really raspy throats. They cough up a lot of mucus and a lot of other bad stuff. Thanks for watching my video about the respiratory system. I hope this helped you in any way. Bye.